Good afternoon, everyone. My name is Lukenio Price, and we are going to be looking at the lesson Interpretation of Prescription Orders. So these are the objectives for this lecture. And the lecture will be divided into three parts. The first part, we'll be looking at legal prescription, the different types of prescription, and the parts of a prescription. The second part of the lecture will look at the common symbols and medical abbreviations, and we will then look at a third section with regards to medication errors and label writing. I would like for you to pay attention to the reading assignments. They're there on the screen. I admonish you to go through the lessons there, or the material there rather, and it will supplement what I am delivering here. I will also send you the slides and additional information for your own reading. Now we're going to look at some definition of terms. First term we're going to look at, the first thing we're going to look at is what a prescription is. You go to the doctor gives you a piece of paper, you carry that piece of paper to the pharmacist, and the pharmacist dispense medication to you, and we call it a prescription. So what is it? It's a legal document, you see. That means fraudulent prescriptions can be written. Persons can write prescriptions that are not supposed to be writing. They are not licensed pharmacists, and they are not a medical doctor or a licensed veterinary surgeon or dentist. So therefore, that is an offense, a criminal offense. Therefore, it's a legal document. And this document must be kept for 2 years at least in a safe place, observing confidentiality for the patient. And this is required by the Pharmacy Council of Jamaica. What's a medication order? A medication order is pretty much a prescription, but it is an order written by a physician within a medical institution. So it is not a doctor's surgery, but it is in, say, a hospital or a nursing home. So you have residents in these institutions that you're going to be writing an order of medication for. And the medication may range from a simple tablet to a liquid to IV, okay? And this is an example of a medication order. Notice that your medication order differs from your prescription in that it has specific time in which the doctor may want the drug to be given. Now, this may or may not occur. The doctor may just say 1 to 3 times a day, but the doctor may specify a particular time of day. And if you notice here, you have hospital number, service may mean the ward in which the patient is in, and the room. So it's quite different from that of a prescription. And if you notice, you may or may not have the duration of therapy here as well. What are the elements of a prescription? 1, you must have somebody writing the prescription, and the person writing the prescription must be the prescriber, a licensed medical doctor, and he must have his name that is legible and his registration number. You may notice that when you get your prescriptions, you can hardly read the prescription, let alone read the doctor's signature. Can't make out his name. You'll have to ask the patient, what's the name of the doctor? Who did you see? This is not required by law. What is required by law is that it must be legible, clearly identified, written in block letters preferably, and their signature and registration number attached. If their signature is not attached, it's not a legal prescription. The RX symbol must also be attached to the prescription. The RX symbol is a Latin term that means take thou. So anything below the RX symbol is what the prescriber would want the patient to receive. In addition to that, patient details are fundamental Patient's name is important because you need to match the prescription with the patient. So the patient's name needs to be there. The age is normally there, not all the time, but it should be because age has implication in terms of dosing for child versus an adult, for example. The address, very important that that is there because if anything happens, like there's a mix-up in medication or you made an error, you may need to contact the patient. And if we expand this a little more, address could be home address, a geographic location, as well as email address, right? We're living in the age of technology and social media. So all of these programs that you would encounter, especially when you're doing entering patients' data within the pharmacy, you may see additional social information that may be required to be entered in the patient's profile. Other details may include the weight of the patient and the body surface area, which may be attached to dosing. The date and the duration of the prescription is also important. You can't just write 500 milligram amoxicillin. What does that mean? What strength? You know, for how long are you going to give the patient and at what frequency? And the date of the date on the when the prescription was written is also important because you need to be able to determine when the prescription was written so that the pharmacist can make a decision as to whether they should fill the prescription using the same amoxicillin, which is an antibiotic. If that prescription was written 3 years ago, or let alone 3 months ago, we will not fill it because it is either the infection has gotten worse or the infection has resolved. And in the age of antibiotic resistance, these are some of the things that we need to know as pharmacists. As I mentioned before, name of the name, strength, and quantity of medication is important as well as the duration of therapy. So amoxicillin is not enough. You need to tell me the name. Yes, amoxil. The strength, 500 milligrams. What are you giving? What's the dosage form? Is it capsule? Is it suspension? And for how long are you giving it? And for how long are you giving it? That would indicate the quantity of medication or capsules you are going to dispense. Because if it is given every 8 hours for a week, you know that you're going to be giving 21 500 milligram capsules. A prescription can be written by a veterinary surgeon or a dental surgeon or dentist. These are in addition to the medical doctor and the nurse practitioner. Now, nurse practitioner is able to write prescriptions under the direct supervision of a medical doctor. So there are 5 persons who can write a prescription legally. Medical doctor, veterinary surgeon, dentist, and a nurse practitioner. A pharmacist, the 5th one, can also write a prescription. However, a pharmacist cannot write a prescription to treat. A pharmacist can write a prescription as a copy of what a physician has written. Say, for example, you are buying a prescription for hypertension and it is lasting for 3 months, you only bought 1 month, then a pharmacist can rewrite that prescription or write a copy prescription for you to get the remaining 2 months. A prescription may be given verbally in addition to physically. A scenario would be you're ill or your child is ill or somebody at home is ill in the middle of the night, doctor's surgery is closed, you can't reach the hospital, you call your doctor because you have that kind of a relationship. The doctor can call in a prescription the following morning for you to go to the pharmacy. So once you do that, you can go and pick up your medication. However, you have a certain time frame that requires you to give the pharmacist a hard copy, a hard signed copy by the physician prescription. for her to put on her file, and that is in the Pharmacy Act. This law was written long before you and I were born. We are now living in an electronic age. Everything is done on the internet. And in light of what's happening around us, e-prescribing is the trend, is the way to go. So I believe it is on the table for the Pharmacy Council of Jamaica to discuss e-prescribing. And once e-prescribing is allowed or passed by law, then you can have prescriptions done written, verbally, as well as done through the internet. So we're looking forward to that. But presently, we can only accept prescriptions that are verbal, that are written and handed in physically, one, and two, verbally. But you will have to give the pharmacist a hard copy within a certain time frame. I believe that time frame is 3 hours. I will update you once I send off these recordings. So what are the responsibilities of a pharmacist when they have gotten the prescription and are ready to dispense? In terms of label writing, 1, the name of the pharmacy and address needs to be there, the prescription number, the name and quantity of the drug, important instruction, that is instruction in use, storage, and any other special instruction for the patient, the doctor's name. Now the pharmacist's name is written here, and that is not required, really not required. We ask students to write their pharmacy name here, or their names there, in order to identify, especially when you're doing dispensing or compounding in your laboratory courses. Then we need to identify who compounded this prescription. But typically speaking, a pharmacist does not necessarily need to have her name written on the label. The date of the dispensing needs to be there, expiration date needs to be there, as well as beyond use date if it is an extemporaneously compounded preparation. Now we're looking at the parts of a prescription. So you have a prescription in front of you, but they're all divided into certain parts. First part is the superscription, which consists of the heading where the symbol RX is found, right? So you have above that superscription, you have the name and address, date, everything with regards to the patient. Then you have the superscription that has the RX, or which is the symbol RX. And then below that, you're going to have the inscription, which is really the body of the prescription that contains all the necessary information for the patient and the pharmacist. It will give you the name and quantities of the medication, the dose, dosage form, the frequency, not the frequency, I'm sorry, the name, the dose, the dosage form, such as tablet, capsules, and syrup. Below that, you can have the subscription, or you should have the subscription, which gives the direct directions for the pharmacist on how to dispense or compound the medication. And then you have the signature, which is normally written as SIG. This gives the instruction to the patient on how the drug is to be taken, at what frequency, and for how long. Okay? So this is an example of what we discussed. So if you look here, above this would be your superscription. So that's the RX. And above that, you have the name of the patient, age, etc. Then you have the subscription, and sub means below, right? So it is below the superscription that you have the ingredients, the name of the drug, the concentration of the drug, and also how much of the drug you're going to give, right? So here we have some symbols here, which we're going to go through after. Then after that, we are going to have the Oh, I'm so sorry. We have the inscription that has the medication prescribed, which includes the concentration, and the amounts. And then we have the subscription that tells the pharmacist what to do, if it is that you're going to be making something or you're going to just dispense something. And MFT1 capsule is the information for the pharmacist, which represents the subscription. And then you have the signal. And this is the signal. This is what is going to tell the patient what and how they're going to take the medication and for how long. So the frequency here, TID, will determine what that means in a moment, and HS, these are frequencies. And this tells you whether you're going to take it in regards to meals, whether you're going to take it by mouth, or whether you're going to inject it. And this tells you for how long, the duration. So frequency, and this part is for how long, which is duration. And that's called the signatura, or SIG for short. And then you have special instructions. You might have seen this on your prescriptions, the number of refills, the name of the doctor, and their signature. And you also need to have their registration number in order for it to be legal. So we'll discuss these in more detail in your manual and in your reading assignment. All right, so we're going to pause here, and then we will get back to the recording, where we'll be looking at the abbreviations, common abbreviations that you will encounter.